Hello and welcome to Wellness Series with Lush, a platform that gets us in touch with our well-being. I'm your host, my name is Lucia Mulebadzi. Today we're discussing a topic of health that is very close to my heart, women's health. And to help us discuss that, I have in studio Dr. Tanyala, who I know, or I've heard around, that she's also very passionate about women's health. Dr. Tanyala is a general practitioner with interest in women's health. So I'm right to say you're passionate about it?
Very true, I am.
Yeah.
And thank you for having me, Lucia.
Oh, you're welcome.
Thank
You're welcome. All right, let's just lay the foundation nicely and maybe just take us through what is women's health?
So when we talk about women's health, we're referring to an array of areas, different areas that encompass what is a woman.
Okay.
We are talking about the well-being, the mental well-being, the physical well-being, the psychological well-being, overall well-being of women.
Yeah.
In particular, my interest and the passion that I have is in non-communicable diseases, and in particular in prevention and screening for specific diseases, especially cancer. Because we do have a large number of our women who still fall victim to not having the right tools or the right information to avoid progression into these conditions that I'm referring to.
Yeah, and we all know that preventative care, it's much easier from a financial point of view, psychological point of view, than curative health care. Now let's bring it to home, Mobotswana. Like you can even take it down to your clinic. What are the most common cancers found in our country that our women out there need to be aware of?
Well, in general, and with specific focus to women, we do see a lot of cases of cervical and breast cancer.
Yeah.
There are other cancers that are very common, but particularly in women, these are the two that seem to be frequenting our clinic rooms, our consultation rooms, where women present with symptoms and are not aware and have probably had them for some time, but have not necessarily thought of them as anything serious.
Yeah.
But cervical and breast cancer are the main ones that we see at private healthcare level.
At private healthcare. All right. And you know, when we look at, I know that most cancers are said to be hereditary, right? But also lifestyle plays a huge chunk in predisposing one to having cancers. In our case, breast cancer and cervical cancer. Before we get down to how we can actually prevent it, what are some of those lifestyle elements that can actually predispose one to having the different cancers, breast cancer and cervical cancer in our case?
There are a couple. Some of them are what we call non-modifiable risk factors. So these are things you can't really change.
Yeah.
That because you are born, you inherently have them. Family history is one. Your gender is the other. Age is one of the risk factors for some of the cancers. But in all fairness, especially in the environment we live in today, it's the modifiable risk factors that seem to be gaining the lead in terms of predisposing women to cancer.
Yeah.
And the modifiable risk factors that for different types of cancers are different, but there are some that are that just cover everything.
Yeah.
Smoking, cigarette smoking in particular, a sedentary lifestyle, so where exercise is very limited or non-existent.
You just sit there.
Lazing on the couch and enjoying a series on TV, but essentially not being active. Maintaining a weight that is unhealthy, that is a risk factor on its own. Diet as well. We buy a lot of processed and refined food, and all of these do not necessarily have the nutritional value of the original non-processed and organic food that you would get from your farm or from your fruit vendor or vegetable vendor. And we need maybe to be more aware of that. And so other risk factors would include, especially for cervical cancer, it's risk factors that are associated with sexual activity. So primarily because cervical cancer, the biggest risk is human papillomavirus infection, HPV. And HPV, women who are most likely to get HPV are those who the first sexual encounter is at an early age. So it's extremely important to encourage our young girls to delay their first sexual experience. Women who have multiple sexual partners, women who've had multiple pregnancies, but particularly because of the risk of exposure, previous sexually transmitted infections. So some of these are things that when we're sitting with a woman and discussing the risk factors, we try and highlight and establish whether the woman is at risk or not.
I think as doctors we need to thank you, because I see a lot of movement along the roads, people jogging, people walking. Maybe along the line somewhere we're doing something right.
Definitely.
So we need to applaud you for just keep advising us to do that. Maybe we need to start working on what we consume now. But those are very relatable, and I think viewers out there can relate to some of those. What you eat, does it build or destroy your body? And obviously, are you going to sit, do nothing, or will you take that walk? It doesn't have to always be intensive workout.
No, it doesn't. In fact, the recommendation is at least 30 minutes of aerobic exercise. And aerobic exercise doesn't necessarily mean going to the gym. It just means finding something that will increase your heart rate. So whether it's skipping a rope or climbing up and down stairs, it's not even something that needs to take you out of your home or comfort zone, but it is something that is necessary at least 5 times a week.
I can do that.
We can all do that. We can all make time. I think a lot of women also have that busy schedule, raising kids or building career excuse, but your health always comes first, and you cannot postpone a healthy lifestyle.
I think taking care of yourself is one way of giving yourself that love. Nowadays we hear young women, even elder women, talking about self-love. And then one way of doing it is taking care of yourself.
Exactly.
All right. So what is it that as women we can do? I love the fact that when you spoke, you actually brought in the girl child, and the importance of empowering them at a younger age so that they grow knowing what to do and what not to do. So what is it that as a woman you need to know to be able to play a role in preventative care for, let's start with breast cancer, for instance.
Okay, so for breast cancer, and this is something that I always encourage my patients who come in, especially if they come with their daughters, it's important to know what is normal. It's important to regularly check your own breasts. This is something that should start at an early age. And there's specific techniques on how to do it, and the best way to learn is not necessarily from, what you hear out there. But when you do go for your annual medical checkup, it's important to ask your doctor, how do I do this? How can I do this? Or a practitioner nurse, how do I examine my breasts? Because it's one thing that can, help with early detection. If something is picked, you'll be able to know that this feels abnormal. This is not something I feel all the time. And once it's picked, diagnosed, managed, you may find that you've avoided a huge train smash just by feeling your breasts as often as possible.
And what is, sorry to disturb you, but what is that often as possible? Does it mean as a lady I need to do it every day, once a week, once a month? When is the right time to actually do a self breast exam?
Ideally, I usually say to my clients once a month. Not during the cycle, not during the period, because there's a couple of changes that happen to the breast before and during, but perhaps a bit somewhere after the normal cycle, the normal period. Just once a month is fine. If you do forget once a month, then let it be once a year when you do your annual medical checkup. But it's extremely important that every woman appreciates what is normal. So that when something abnormal comes, they're able to pick it. So it's not just the breasts that are examined, it's also under the arms. And under the arms may be a bit easier because if you feel a lump under your arms, it may mean that you have an enlarged lymph node, which drains from the breast.
Okay.
So that would also be a clue. So that's also one of the things that we always try and bring attention.
So it shouldn't just be on the
breast tissue itself.
Yeah,
Yes.
it has to extend to under the arm.
Yes.
All right. And just in summary, so that we move to the cervical cancer, what are just some of the red flags? You know, you're touching, you're feeling your breast. What are some of the red flags that one needs to be very alert when doing the exam?
Okay, so first thing is you look at your breast. Every day, have a look at your breasts. Make sure you appreciate how they look. Some are asymmetrical, they're not the same size, but that may be normal. But if you notice an abnormally large breast, that is abnormal. If you notice that the skin over the breast has changed, that is also abnormal. And the typical changes that we sometimes describe are if you see an ulceration, a wound on the breast, if you see like the nipple pulling back, what we call retraction, or if you see small dimples like the peel of an orange on the breast skin, then that's something to take to your practitioner to have it checked. So once you've looked, then you touch. And if when you're touching, you realize that there's a lump, whether it can move or it can't move, whether it's painful or it's painless, that is something that needs to be checked. If when you squeeze the breast, you find that there's a bit of discharge or blood or anything coming out of breasts of a woman who's not breastfeeding, that is also something that needs to be checked. So it's basically just being aware of what is normal, because once you notice anything strange, you will definitely know that this is not normal.
And we can't overemphasize that. For you to be able to know that there's something wrong, you have to know what is right.
Exactly.
All right. And then the other major female cancer that you say, we do have it here at home and it's a concern, is the cervical cancer, which is caused by the HPV virus. How does one take ownership of that? How do I know, or what is it that an individual, a woman, can do to play a role in the preventative care for cervical cancer?
It's interesting that there are still a lot of women who don't know what the cervix is. And it's not because of ignorance, but perhaps it's just that we're not making enough noise about it. Cervical cancer is one of the female cancers that can actually be prevented because it has a screening tool. So we are able to detect beforehand, before cancer, when a woman has cervical cancer. So the cervix is the connection, is the end of the uterus where the uterus meets the vagina. And this part of the body is very prone to certain changes that can be caused by human papillomavirus. These changes can be noticed when we do simple screening tests. And the one test that every woman should be able to do is a screening cervical test. So we have Pap smears, we have the visual inspection with acid, which is done. It's called the test and treat. They do the test immediately and they're able to give you the result immediately. And this is done in a private and public clinics.
In all the facilities.
Yes.
Every time I mention Pap smears, Pap smear with non-health colleagues or friends. They always say, ew. And I suspect maybe that's why we don't see enough women with the courage and empowerment to say, Doc, I'm here for my Pap smear. What can be done, to reassure women that it's okay and we're not hurting you? Actually, this is to help you.
I think for the longest time, the fear has always been the tool that we use to do a Pap smear. A lot of women, when you bring it up, they will always say, no, I'll come. And when you dig to the bottom of it, you find that it's just the fear of what we use, the tools that we use. Because when a woman does a Pap smear, it's a very fragile position she's in. It can get very uncomfortable. But in the right hands and with the right information, it's just a less than 5-minute exam that could ultimately change their life and prevent what could have been a disaster. So what is important is for women to know that it's not painful. It is slightly uncomfortable, but it is not a painful procedure. And just 5 minutes of discomfort for a lifetime of, whether it's getting the right diagnosis and getting treated early, or knowing that you don't have any risks, you don't have any pre-cancer lesions, that alone is worth the 5 minutes.
Yeah. And how young can one start performing a Pap Smear? At what age? As a mother, I have a daughter.
Right.
So when should I start saying to my daughter, you need to go for a Pap Smear? And then in terms of how old do you say, I'm old enough now, I don't need a Pap Smear?
So ideally, the recommendation in Botswana is that all women over 30 should be screening.
Okay.
But I always say every woman who's sexually active, whether you're in your 20s or it's important to screen if you're sexually active, because it means your risk of acquiring HPV is high. And for women in their 20s, we usually recommend that at least twice in that decade, in your 20s, if you're sexually active, get screened. But for women in their 30s, it can be once every 2 years, depending on the risk as well. But it's different in the private and the public sector. But once every 2 years is reasonable.
Yeah. Does that go for 40 and above?
Including 40 and above.
Okay.
So we continue screening until around 55, 65, depending on whether or not we have detected any abnormalities in the younger ages.
Okay.
But we encourage all women to go.
Please.
Regardless of the age, if you have been sexually active, you have children, that is the time to do it.
Yeah. And just to go over what you said, cervical cancer is one cancer that can actually be prevented if only we take that ownership to do the screening bit. And just wrapping up, Dr. Tanyala, it's February, it's Cancer Awareness Month. We can. What can you say to now? I'm not going to say women only, because we have brothers, we have fathers, we have partners. What is it that we can do to support each other? Because the theme for this year is I can, we can. In closing, what can you say to that?
It's important to know where you stand. It's important to know your risk profile. It's important to know your family history. It's extremely important to also know your condition. If you already have a certain diagnosis, it's important to learn about it, to know what the outcome is, and know that we have expertise in the country. We have specialists who are able to assist. So it's never the end when we diagnose somebody with any of these conditions, because the earlier the detection, the better.
Yes.
So my message is still screen, get checked, do your annual medical exams, and ask questions. Learn how to do different things that can help you ultimately, keep your health where you want it to be.
And don't wait to feel that pain. You can still go even if you're perfectly fine. To go and ask.
Exactly. And one more thing, especially in our elderly women, I know we wanted to make it general. I think one of the most important messages out there is that if you have a mom or an aunt or somebody who's over 50 who presents with bleeding after their period has ended, or with a strange discharge that is not responding to treatment, those are things that should not be overlooked.
Okay.
They are sad cases that we see where women present like that, and it's something that could have easily been prevented by a simple check, a simple smear, and but we still see that. We shouldn't be.
Yeah.
So it's extremely important for everyone to take their health seriously. If you don't take care of yourself, no one else will. And to make sure that we engage with our practitioners, with our doctors and nurses.
Yeah. We shouldn't be afraid to engage with you. Thank you very much, Dr. Tanyala, for joining us. I hope to see you again sometime soon, and then we'll talk about those non-communicable diseases, the other ones that you did mention. Well, that's what we had for you for today. Thank you for joining us. I do hope that today's show has inspired you to well up and take ownership of your well-being. See you next week.